This is Chapter 7, Respiratory System lecture. One of the big problems that we see in the respiratory system is chronic obstructive pulmonary disease, COPD. Your book also designates it as a synonym of COLD, but I've never really seen that abbreviation used in charting. It's usually always been COPD in my experience. But what is chronic obstructive pulmonary disease? Well, this is a term that is an umbrella-like term where there's disorders that fall underneath that category. So we're going to talk about each one of those. COPD has three major disorders: asthma, chronic bronchitis, and emphysema. So COPD is the umbrella, and underneath that falls these three disorders. Now, you do not have to have all of these to have chronic obstructive pulmonary disease or COPD. Just one of these conditions classifies you as a COPD patient. And so we'll talk about each one of those. Asthma, you guys have all probably heard of, and it is when a patient has spasms in the bronchial passages that are sudden and violent. So typically when a patient has an asthma attack, you will hear them breathing, and they will have a characteristic wheeze when they breathe. So you may hear. These spasms are sudden and violent, and that term that is used to describe sudden and violent is the term paroxysmal. So any condition that is sudden and violent in nature is paroxysmal. Asthma is caused by a swelling of the bronchial tree and an increase in mucus production, which makes it hard for the patient to breathe. Asthma is caused by an exposure to allergens, stress, cold, and exercise. Allergies is a huge contributor to asthma patients, and going out in the cold sometimes will cause patients to have asthma attacks. And some patients have exercise-induced asthma, where they only have asthma flare-ups when they are doing some type of cardiovascular activity. So here is a cross-section of what a normal bronchial looks like. And here's a cross-section of what a bronchial with a patient having an asthma attack looks like. So you can see that the mucous membrane is very swollen, and then they have this excessive mucus secretion. So if you imagine trying to breathe through this, like this is a straw and you're trying to drink up like a thick milkshake, it's going to come up through this straw very easily. This one, not so much, because there's just not a lot of entryway for the air. Chronic bronchitis, then, is inflammation of the bronchi primarily caused by smoking and air pollution. This can be caused by bacteria and viruses as well. And chronic bronchitis is characterized by a heavy productive cough. Now, chronic, if you remember, means something that's long-standing, meaning it occurs for a long period of time. Now, you may get bronchitis in the winter and then it goes away and you don't have it again. So that's not considered chronic. Chronic bronchitis would be bronchitis that goes on for several weeks to months at a time. And so obviously patients that smoke are going to be have that smoker's cough or that chronic cough that's heavy and productive. Emphysema, then, is a form of COPD, and it is caused by decreased elasticity of the alveoli. If you remember, the alveoli are the tiny little air sacs in the lungs. So if we go back to this diagram, these are the alveoli here, and they have an elastic, these little bubbles, if you will, have an elastic property to them that when air comes in, they expand and then they contract. Well, in emphysema, they expand, but they are unable to contract, so they lose that elasticity. It's kind of like a rubber band that when it gets old, it loses the ability to stretch, and so it may snap. Emphysema is often associated with long-term smoking, but I've seen patients who have emphysema that have never smoked a day in their life. These are typically the patients that you'll see at Walmart that are, driving around on their little scooter and they have an oxygen tank because they have a lot of problems breathing. So Each one of those, if you have one of those, you're considered a COPD patient, whether it be asthma, chronic bronchitis, or emphysema. Symptoms of COPD, the patient would have dyspnea, and if you're in this chapter we'll learn that PNEA is a suffix that means breathing, and dys, you will remember, is a prefix that means difficult. So you have difficulty breathing. SOB is shortness of breath, and a chronic productive cough. A problem that can occur in the respiratory system is a pleural effusion. A pleural effusion is excessive fluid collection in the pleural cavity. Now, when this happens, a patient will again have shortness of breath, and they will have difficulty getting good air exchange. Now, treatment of that is a procedure called a thoracocentesis. And if you look in your book on page 180, you will see a thoracocentesis picture. So basically with a pleural effusion, there is fluid or some type of exudate which is collecting in that pleural space surrounding the lung. It tends to congregate towards the bottom. So what we have to do is this procedure where they puncture through the back of the patient into and between the ribs, and they puncture into that pleural sac, and then they withdraw the fluid from that area. Now, depending on what they withdraw from that area is the name that it's given. So if they withdraw pus from that area, it's called an empyema. If they withdraw blood from that area, then it's given a different name. It's a hemothorax. So pleural effusions can cause the patient quite a bit of shortness of breath and discomfort. Tuberculosis then is a condition in which it's very highly communicable. It's spread by a patient who coughs and has active TB, and the respiratory secretions go into the air, and then another person breathes those secretions in. So transmitted much like colds and flus are transmitted. And so the tuberculosis can live outside the body for 6 to 8 months on inanimate objects. So when anybody has tuberculosis, active tuberculosis, they absolutely have to be wearing a mask at all times, because if they cough and they put the droplets into the air, anyone around them can contract the disease. Now, tuberculosis is treatable, most likely treatable with antibiotics, but there are some forms of tuberculosis that are very bad called XDR-TB, which is extremely drug-resistant TB. And so, just like its name, we're having a problem eradicating it because it's drug-resistant. The next condition that our book talks about is cystic fibrosis. Cystic fibrosis is a hereditary disorder which affects the exocrine glands. So this is a hereditary disorder, meaning the patient is born with it. It's caused by a mix of chromosomes, one from mom, one from dad, that cross and cause this problem. So the mom and dad don't have cystic fibrosis, but they have a child who has it. So the cystic fibrosis is characterized by mucus in the lungs that's extremely thick, and it blocks the bronchioles. To diagnose this, they do a sweat test, which measures the amount of chloride in the sweat, and then they can confirm a patient with CF. Treatment for this condition are aerosols, percussion. And so I had a picture of a patient. This was one of my students, her grandchild, and she gave me these pictures and granted me permission to use. And so this shows the aerosol treatment that the child is taking. And so this aerosol treatment is hooked up over here to this machine. And then she's wearing a percussive vest. And so this is like this little black vest that has these little rotors in it, and it basically thumps or pounds her chest. And what that does is it helps to break up the thick mucus in the lungs so that she can cough that up. Oncology that we see of the respiratory system, obviously primary pulmonary cancer. This is not a good diagnosis. It's very difficult to control or cure, and the survival rate is very low. 60% of patients die within 1 year of diagnosis, and 70 to 80% will die within 2 years of diagnosis, despite treatment. Smoking obviously is the leading cause of all types of lung cancer, and what we know about primary pulmonary cancer is that it metastasizes or spreads rapidly to the lymph nodes, the liver, the bones, the brain, and the kidney, and so that's why the survival rate is low. An incentive spirometer is a device that you may recognize that patients in the hospital are given once they've had surgery, and sometimes we give these to our respiratory patients. And basically they breathe through this tube and they have a ball that will inflate or move up on this little chamber. And what that does is it gives them the incentive to breathe deeply. If you have somebody who has pneumonia or a respiratory condition or has had surgery and they have an incision somewhere, the last thing they want to do is breathe deep because that puts pressure on the incision and causes them pain. So the incentive spirometer makes them breathe very deeply, and they have to move that ball up to a certain threshold on the meter. Disease and condition terms that you need to know from page 181. Actually, there's not one on 181. It starts on 182. The first one I want you to know is apnea. Apnea, it just means a temporary loss of breathing. And this can happen during sleep. And so sleep apnea is a sleeping disorder in which the breathing stops repeatedly for more than 10 seconds while the patient is sleeping. Apnea is just a temporary loss of breathing, where sometimes we'll see infants that have this problem. The term coryza is a fancy name for a head cold, an acute inflammation of the membranes, also known as an upper respiratory infection. Epistaxis is a fancy name for a nosebleed, so this is a nasal hemorrhage. And the term hypoxia is oxygen deficiency in the body tissues, which is usually a sign of some type of respiratory impairment, which we would obviously see with any of the conditions that we talked about because there's not good air exchange and they don't have good oxygen in the tissues because of it. Medical, surgical, and diagnostic procedures on page 186. The first one, aerosol therapy. I showed you the picture of the young gal that was getting the aerosol therapy treatment. Sometimes it's called a nebulizer treatment. Basically, it's a lung treatment using various techniques to deliver medication in the mist form directly into the lungs or air passageways. So this is used for COPD patients for immediate relief when they're having a flare-up. Oximetry then is a non-invasive method of monitoring the percent of hemoglobin saturation with oxygen, also called a pulse oximetry. So if you've ever been in the hospital and you've seen a patient that has a little alligator clip on their finger and it has a little light, red light on there, that is oximetry. So it's measuring how much oxygen is in their blood so we can determine if they're getting good oxygenation. Tracheostomy, you will see on page 190, is a surgical procedure in which an opening is made in the neck and into the trachea, into which a breathing tube may be inserted. Bronchoscopy then is a visual examination of the bronchi using an endoscope. So basically like the endoscopes we talked about for the gastrointestinal system, only this is going through the nose and down into the pharynx and into the lungs to look at the lung tissue and the upper respiratory airway. Spelling words for this chapter: pulmonologist, cyanosis, lobectomy, oximeter, spirometer, and atelectasis. Abbreviations you need to know for this quiz are listed on page 194. COPD stands for chronic obstructive pulmonary disease. CPR, cardiopulmonary resuscitation. CXR stands for chest x-ray or chest radiograph. SOB, we talked about, is shortness of breath. TB stands for tuberculosis. And URI stands for upper respiratory infection. Obviously, you're again responsible for memorizing, making flashcards for the word elements and their meanings from pages 172 to 175. Several quiz questions will be taken from these medical terms. Here ends the recording of the Chapter 7 Respiratory System.